Hello everyone, welcome to Pulse Ayurveda. Today we are going to see the lecture number 2 of the anatomy series, that is scapula. As we can see on the screen, there is a red color marked portion, that is scapula. It lies on the posterior aspect of our body, that is dorsal view. Introduction. Scapula is also known as shoulder blade. The scapula is a flattened bone and is triangular in shape. The scapula is thin bone placed on the posterolateral aspect of our thoracic cage. The scapula has three borders, three angles, three processes, and two surfaces in it. The scapula also has a glenoid angle or a glenoid cavity. The dorsal surface of scapula is divided into two parts, supraspinous and infraspinous fossa. Now we can see in this image that the scapula is triangular in shape. Now next we will see the features of the scapula, that are its surfaces. There are two surfaces of scapula. First one costal surface, second one dorsal surface. The costal surface is known as subscapular fossa. It is concave, directed medial and forward. Three longitudinal ridges. Then dorsal surface gives attachment to the spine of the scapula, which divides it into the smaller supraspinous and largest infraspinous fossa. The two fossa are connected to each other by the spinoglenoid notch, which is situated on the lateral root of the spine. Now, in the costal surface, the action of serratus anterior is overhead adduction of the arm. Then we could see border, superior, lateral, medial. The superior border is thin and shorter. It is present near the root of the coracoid process. It presents the suprascapular notch. Lateral border is thick at the upper end and is infraglenoid tubercle. Medial border is thin and it extends from the superior angle to the inferior angle of the scapula. Now we can see the angles of the scapula. They are in this image. We can see the posterior and the anterior view of the scapula. That is infraspinous fossa, supraspinous fossa, lateral border, medial border, subscapular fossa, glenoid fossa, acromion, coracoid process. Now we can see the angles of the scapula. Three angles: superior angle, inferior angle, and the lateral angle. Superior angle is covered by trapezius. There is a insertion of it. Now inferior angle is covered by latissimus dorsi. There is origin of latissimus dorsi. Lateral angle or the glenoid angle is broad and bears a glenoid cavity. Now processes of scapula: spinous process, acromion process, and coracoid process. The spinous process is triangular plate of bone. It divides the dorsal or the posterior surface into the supraspinous and infraspinous fossa. The acromion process has two borders, medial and the lateral one, two surfaces, superior and the inferior, and has a fascicle for the clavicle. Coracoid process, it is directed forward and slightly laterally. It is bent and finger-like in shape. Then the muscle attachment of scapula. In this image, the anterior and the posterior both views of scapula has been given. In this image, we can see that there is the insertion of trapezius, levator scapulae muscle, rhomboid minor, rhomboid major, and origins of latissimus dorsi, teres major, teres minus, supraspinatus muscle, infraspinatus muscle, deltoid muscle, then long head of tricep brachii muscle. All these are origin and insertion given in this image. This is the posterior view of the scapula. Now we'll see the anterior view of the scapula. Here has been given the insertion of the trapezius muscle, then pectoralis minus, then serratus anterior muscle. These are insertion and origins of subscapularis muscle, omohyoid muscle, long head of tricep brachii muscle, short head of tricep brachii muscle, long head of bicep brachii muscle, then coracobrachialis muscle, deltoid muscle. All these origins and insertion of the anterior view of the scapula has been given. Now in this next we'll see about the blood supply of the scapula. First one is suprascapular artery, subscapular artery, and then is thoracodorsal artery. These all are the arteries or the main arteries of the scapula which supply bloods to it. Now, as we can see, there are many arteries. But these three are the main of it. Then we can see the nerve supply of the scapula. First one is suprascapular nerve, subscapular nerve, and thoracodorsal nerve. These three nerves are the main nerves which supplies to the scapula. As we have seen that the blood supply and the nerve supply are almost same by names, but only we have to add is artery and nerve to it. So it is a small type of trick. Then we can see a clinical anatomy of scapula. Winging of scapula. The word winging means we could conclude as a hanging word. Okay, it is caused by the paralysis of serratus anterior muscle. In this image we have seen that one side is of normal scapula and other is of winged scapula. So in it, winged means a hanging part, as you could see in this both image. Both images are clearly defined, and we could see here that the winging of scapula. Then the second anatomy of the scapula is scaphoid scapula. It is a developmental anomaly in which the medial border is concave. In which in it means that the scapula is not in the normal position. The medial border of the scapula is more concave, as we have seen that there are three borders of scapula. So one of its border, that is medial border, in this case it gets a concave. Thank you. If you have any kind of doubt, let me know in the comment section. Thank you.